think we're ready. We'll go ahead and open the public hearing for the tax asking budget. Was there any questions, or did anybody have any feedback on the tax asking budget?
I haven't heard anything.
Well, with nothing said, we'll go ahead and close the public hearing for the tax asking, and we'll go ahead and call to order the meeting. And we'll ask for approval of the 2024-25 budget and tax certificate of ask of taxes.
Yeah, so we published the budget according to regulations. The tax asking is $1.08378 per thousand to generate 1.164 million. And budgeted revenues are $75,181,000. Budgeted expenses are $75,181,000 for tax purposes. I've had no comments or questions or anything.
All right.
I move approval of the 24-25 budget and the certificate of taxes.
I'll second.
All in favor?
Aye.
Opposed? Motion carried. We'll go to the approval of minutes for January and February.
I make a motion to approve both January 30th and February 6th minutes as in our packets.
I'll second that.
We have a first and a second. All in favor?
Aye.
Opposed? Motion carries. We'll go to the Med staff meeting by Dr. Anderson.
All right. I missed the past couple meetings with this board, but here today just to give you a brief summary of our medical staff meeting from a couple weeks ago on February 13th. As she often does, Laura started out the meeting talking a little bit about our ACO measures. They're finalizing results for our work in 2023. And then she talked a little bit about some things that we're going to be changing in 2024. One of the main changes coming this year is we're going to be trying to do a little bit better coding for our clinic visits. We're going to be utilizing codes that better reflect how medically complex our patients are. And that's important for Medicare's ACO that we're a part of, that hopefully with time will translate into some shared savings that come back to us. So there's an added emphasis this year on coding for our clinic visits. John Pecci from our respiratory therapy department talked a little bit about cardiac monitoring. We've switched companies that provide our cardiac monitors. Those are the monitors that patients can wear and go home, and we'll monitor their heart rhythms and rates for periods of time between 3 days and 30 days. So there's a little switch there in the company that we use that provides that cardiac monitoring. So John updated us on that. Karen Buman talked a little bit about infection prevention, appropriate use of catheters. We're talking about urinary catheters. There's pretty strict guidelines that are out there for how we should appropriately use those in the hospital setting, and so she talked a little bit about that. Informed us that 76% of our employees here at the health center are vaccinated against influenza, which is actually pretty good considering it was optional this year, if I remember right. And then a little update on the RSV vaccination for pregnant women. There is one of the RSV vaccinations available now is specifically for pregnant women between a gestational age of 32 and 36 weeks. And it provides protection for their babies once their babies are born. So that's kind of a neat thing that's come out recently. We continue to get some teaching and updates on Tiger Connect, which is our messaging and scheduling app. So Caitlin Becker was at the meeting to teach us a little bit about requesting time off and switching shifts through the Tiger Connect app. So that's new technology here that we're learning how to utilize more and more as the months go by. Kim Burchett, our clinic administrator, talked a little bit about openings at the clinic, at the Alcorn Clinic, and also at the Harlan Clinic. There's positions open, as there have been for quite some time. We're trying to fill those. We have a couple staff out on FMLA. And then Kim also talked a little bit about Quick Care Clinic. From what I've seen, the schedules on those Saturdays and Sundays are pretty full. So I think that that clinic is going well. And of course, Claire Krogan and Nicole Topley are covering those days for us on an alternating weekend type of schedule. And then Jill was at the meeting to share with us that Natalie Francis, our new physician, is going to be here to practice late summer to early fall. She's going to be in Harlan in June, I presume, for house hunting, just to make some plans for their move. So we're looking forward to that. And we're still looking at a couple physicians who are potential hires, I guess I would say, for the next year or two, in addition to Natalie. So Jill's actively engaged in that recruiting still. I think Barry covered several things as well, and I imagine he's going to hit on those things later in this meeting, so I'll let him handle that.
Okay, thank you, Dr. Anderson. Next we'll go to the auxiliary annual report.
Okay, I'm Linda Quinn, for those that don't know me, and I'll be presenting a summary of what the auxiliary did in 2023. We use the goals like the hospital does, the medical clinic, the pillars, and our first one is growth. And our goal for growth was to increase our membership by 20 members. And this year we surpassed that goal, and we have 35 new members that have joined. And really our auxiliary is thriving. This is awesome to see these kind of numbers in light of what's going on in other hospital auxiliaries. And some of the things we do to achieve that goal, Cheryl was our leader, Cheryl and Nancy Osborne, and they do a lot of work to assure we work to get new members and let people know what we do. We have a membership table at all of our events. And another thing we did this year, we collaborated with HR, and we formulated a letter to be sent to all of the Myrtue team member retirees. And so that gives them a good idea of what the auxiliary does. And we see a lot of previous employees want to continue with the auxiliary. So that's been a real benefit to the auxiliary. And then under quality, one of our big goals is compliance. And in the last 2 years, we've made a lot of improvement with this. There are certain requirements like there are for any employee. We need to have a background check when we start. This is just people who work in the gift shop and do the skilled bed visits. And there's one requirement for the board members. So background check, health assessment every 4 years. The influenza vaccine is the same as Myrtue's, and that's, we just have to make sure we have our documentation if we got the flu shot, or declination if we did, COVID documentation, and then all of the board signs the HIPAA confidentiality in addition to the gift shop volunteers and the skilled bed volunteers. And previously, we didn't have a real good way of monitoring this, and now we have a very good process. Cheryl Burchett is in charge of that, and we're at 100% now. And so we've really appreciated getting there and having the help of HR. Sherry has helped us a lot in knowing what we need and helping us assure we get that. And then, would you go back, please? Just the last thing there, one of our goals is to assure we have every program we do in our volunteer voice. And our volunteer voice is our newsletter that goes to all of our 250 members. And it's the way that we communicate with them so they feel like they know what's going on. The board knows what's going on, but we need to make sure our members know what's going on too. And Ruth can attest to this. It's hard to get all of that in, and many times she says, well, it's full. And we're like, well, will you put this in yet? But anyway, we really do that for good communication with our members. Okay. And then under people, probably our primary thing we do under people is employee or Myrtue team member appreciation events. And it's been maybe one of the most rewarding for us as auxiliary, and we get a lot of feedback. What we do 4 times a year is pass out treats to all team members. And Deb Drawn is a previous employee, retired of Myrtue, and she has good ideas for this, and one of her early on ideas was that we need to get this to everybody. Behavioral health, wellness center, PT, all the satellite clinics, which Kim can attest to that. So those are all delivered. And then we go around with the cart and deliver to everybody here on that given day. But so on these pictures, you'll see people delivering, and 90% of them are Myrtue retired employees. So, and they love it. And then down to the bottom, that's Patty Miller, and she has been involved in the Valentine cookies and treats for as many years as I remember. And Patty passed away this year, so we wanted to recognize her for all the work she did, and she loved treating Myrtue team members. Okay, then next under people. We really have worked hard with marketing. Barry has, we've talked to Barry, and he has talked to us about using marketing more, which we've done the last 2 years. It's been remarkable what they've done to improve just the quality of all of our things that go out. So we've really appreciated them and their ideas. And then we also wanted to have more appreciation for our auxiliary board, which we've done that this year. We gave t-shirts, and we did special things for them, like with food for special events, with Volunteer Month, and it was very much appreciated. They do spend a lot of time and, you know, share their talents. And this is the first year. This picture is the fair parade. This is the first year the auxiliary has participated with the fair parade, and we participated with Myrtue, and it really went well. And we distributed some Myrtue auxiliary items that marketed for us, so we'll do that again next year. And then 2 members, Cheryl included, attended a Iowa Hospital Association volunteer educational and brought some good materials back that we could implement. And then service is probably our biggest thing. And the top picture there is Cala Polberg, and that's the Tree of Lights. And again, we looked at different processes that weren't working the best and made some changes, Cala did. And we got some really cool ornaments this year. They're usually a memorial ornament. And she got it from Iowa. These people from Iowa, really pretty angel. So that process is going very well. And then these other pictures are the bazaar. Can't see them the best, but the bottom there is Pat Heminger and Jolene Barron. They're the buyers, which they do an amazing job. And to the left is Cindy and Jolene. They were the chairpersons for the bazaar. And then up above, we've had a lady that donates quilts, and those are the 2 quilts along with Wava and Denise. And then more on service. The top picture there is the chamber ribbon cutting when we moved to our new location. And I have to say, I really do want to thank the board and administrative team for everything you've done, because that new location is phenomenal. I mean, it's prime location. We all know prime location is hard to get, but it is very, very nice, and we get tons of compliments on it, and we're seeing more traffic, obviously. And we were happy to have the chamber be a part of that too. And then down below there is auction concessions. This is the first year we did that as well. Osborne Auction asked us to be involved in Patty Miller's auction, which we were really happy because she's a longtime member of the auxiliary. And like I said, she passed away. And so we were able, the auxiliary provided the food, beverages, and then we made the profit. And it was profitable. And then did we get one or two more?
We did one more.
One more in 2023. And now we have one scheduled for 2024. And again, the auxiliary provides, you know, the food donations, and it's really been a good moneymaker. And then down below in the middle, there is Loretta Harder. Bless her heart, she can crochet like no other, and she crochets blankets for our newborns. And she's really proud of her work too. It's fun to see her. And then we have Kathy Keenest, who makes hats. And we're going to pass those around just so you can see them. But this year we're going to do something a little bit different, making sure that these moms know that they're from the auxiliary, because we've just given the birthing center the blankets, the hats. And then we want to put a nice note in there and make sure they know these are from the auxiliary. And then we had 90 babies this year, and every baby got a hat, and that's okay. Most of them got an Afghan. Okay. Then we're going to show a short video.
Find my mouse.
This is what Janny and Leah Marie Photography did, and it really... And that was on our Facebook page. Okay, so we moved to our new location in October, and Barry had talked to us about a year ago about possibly increasing our hours. We talked about that for pretty much the whole year and wanted to do that when we moved to our new location. So now we added 1 hour per day. So we did that in November. And then the gift shop, we named the gift shop Unique Boutique. I think that's gone over pretty well. And obviously we love our location, and just wanted to give a huge shout out to maintenance, because there's a lot of communication with a lot of women throughout that process. And we understand, but they did a lot of hard work, and it really turned out nice.
And they're still doing a lot of work for us.
Okay, then additional service projects. To the right there, this is one of my favorites, but we do scholarships, and we give $800 scholarships to students interested in a healthcare field. And then down below there's Jan Gieser, and she's in charge of the skilled care visits, and we continue to do that. That process is going great. And then on the left there, the helicopter. That's our POP tours, the pediatric orientation program. We do that during hospital week, and the auxiliary volunteers lead the first graders around the hospital clinical departments, just to give them an idea about what happens in the hospital. The clinical departments do an amazing job with this, but that helicopter is a highlight. It doesn't come every day, but when it does, the kids are just super excited. And this year we did fourth graders too, because they missed out during the COVID year. So another of our projects. And then our last service project is Jill, RSVP. Jill, this is Retired Senior Volunteer Program. Jill talked to me, I think, last summer, and just said, what do you think about, starting this program? Could auxiliary provide the drivers, recruit and provide the drivers? I thought right away it was going to be a great program, and it has been. We provide transportation to local doctor appointments, and that includes all the rural health clinics. We started with 5 drivers, wasn't enough. Now we have 12 drivers. We have drivers Harlan, Erling, and Avoca. And Jill spoke with me this week and asked if we could try to get Shelby and Elkhorn drivers. So that's going to be our goal, to get drivers for that. We have had, we've driven to Rural Health Clinic in Harlan, to Shelby. We've driven to behavioral health a lot, and we've gone to the specialty clinic, and we took a patient home from the hospital. We've provided a lot of, again, it's just medical appointments. And we started this October 19th, and October to December we gave 26 rides, and we had 1 ride that we weren't able to honor. Nobody could drive that patient. We even took a patient from Audubon to PT here in Harlan.
How do you find out about that?
Oh, well, we collaborate. HR, we couldn't do this without HR and patient access. Patient access, Teresa Dorr sends us drivers a text and says what's all needed.
Okay.
And then we just reply and can see what others have picked up. And then she continues to send out probably weekly text what is needed. It's really a really good program, and the comments from patients is amazing. They are so appreciative. One, that we do it, that it's free. They talk about, it adds up when they have to pay for that. And one man recently told me he went to a meeting, it sounded like a needs assessment, and it was a #1 thing the patients in that audience said they needed transportation to appointments.
So I'm so confused. As a patient, do I talk to my nurse? I don't talk to HR.
You schedule your appointment. If you
Okay.
indicate you need a ride, then they'll bring you.
Okay, all right, got it.
Yeah, and that goes to patient access. Okay.
And I want to say, since you've started, we've delivered 48 total rides, is what Teresa provided to me. So that's quite a few.
That is, that's awesome.
Mhm.
Very good.
Yeah. We're really proud of this. Okay. This is the auxiliary board for 2024, and I just have to compliment, our board from 2023, the board for 2024 is going to be strong. These women donate so much time, and they have a lot of talent, and just, our members too. We're just seeing more members being active with our different projects, and we appreciate every single one of our members. And I get to pass the baton to Cheryl Ferry, who is now the president.
You have big shoes to fill.
But Cheryl and I have worked together for years, so it's a good team. And then we're just going to pass out a few things so you can look at, just those blankets and hats. And if anyone is interested in becoming a member, you really don't have to be active. We're passing out our membership applications. And then a volunteer voice, just
You want to join?
we got Kate last year. Anyway, our volunteer voice, really thank you so much for all the work you do for that, because it's such high quality, and she decided we should do it in-house this year to save some money. It still looks awesome.
I don't think they will all be.
So thank you.
Thank you. I think one of these guys are given to you.
Yeah, I have for the
If
hospital.
you've ever seen that.
I thank the auxiliary for all that you do. And you specifically, Linda, for your leadership. I've seen significant growth in the auxiliary and the support of the hospital over the last 2 to 3 years. So thank you.
I would like to say, Barry, I have thought about this for the last month, but being the president was not hard for me, but it's because of everything I learned at Myrtue as a manager. And it's a truth. It's like leading a meeting, conflict, all that stuff. I learned as a manager at Myrtue, the education, work with my team members, and that's where I learned
How many of those does she make?
Kathy just made 100 of those hats recently, brought in 100 hats. Yeah, maybe we have 90 days. It's been a while. It's to put on napkin for every baby. Last year she made 37. And they're beautiful.
Oh, yeah. Wonderful. That's awesome. She's so talented.
So this is
the package she was talking. It'll be more of a package than she has in there. Also a white one here.
And then we'll have a card in there. That's from the So thanks to all of you.
Right, fantastic. Thanks, Cheryl. Thanks, Linda. We do appreciate everything the auxiliary team does for us, and it shows. You just got to look around, the gift shop, and everything you guys do. So it's appreciated, and thank you very much.
We'll share that too with the board, and thank you. We appreciate that.
Next, we'll go with the quality improvement report by Laura.
Okay, we had our system-wide QI meeting on January 17th. Cardiac rehab had monitored the 6-minute walk test, an exercise improvement, looking at patients as they come into the program and where they are as they finish the program, and at least a 10% improvement, which is going really well. Infection prevention monitored healthcare-associated infections. We had no catheter-associated infections. They monitored isolation precautions and hand hygiene. The specialty clinic monitored after-visit summaries and hand hygiene as well. Rehab services is really focusing on fall prevention and doing the fall risk screening. And they really want to make sure they're identifying those patients and have a plan of care in place for patients that have experienced 2 or more falls in the last year. Respiratory therapy monitored compliance with the sleep lab requirements, adverse reactions, which were none, and they had 100% compliance with 2-patient identification. Senior Life Solutions monitored hand hygiene as well, fall risk assessment, and follow-up communication with patients that are done with the program. They reach out to patients at 1 week, 1 month, 3 months, and 6 months, and they're doing that 100% of the patients that finish that program. So that's really great, and that's all I have.
Thank you, Laura. We'll go to the Joint Conference Committee, approval of the policy and procedure revisions by Karen.
All right, this is in your packets, starts on page 9, and I will pass around. These are the full policies and procedures in that book, but I'll go over the summary that's in your packets. So we do the full manuals. We divide it out throughout the year. So we do the full manuals, and this is for February through January of last year to this year. So for those departments, we did administration. They had some revisions to, as we talked about, the mileage reimbursement. We've talked about that in the past. Also, our administrative spending limits was looked at, and then the clinical services and contracts that we provide to patients is reviewed annually. So those were all reviewed and revised as needed. Business office had a new policy for insurance billing. This is basically guidance on account resolution with patients and follow up with any non-compliance. So that was a new policy they had developed. Emergency preparedness, we've talked before, severe weather, we do now do sheltering in place. So rather than removing all patients from their rooms, we leave them in their rooms. We make them as safe as possible in their rooms during a tornado warning. For communication, we added into our plans our new Tire Connect communication, as well as our lip and cot policy and procedures. So those were changed or revised in some of their plans. As you can see, laboratory, they have, I think, like 10 or 13 manuals for each of their different processes. Of all of those, basically the only one that really changed was in their general policy manuals. The new fire policy was basically aligning with our new fire policy that we put out with our new standards for that. And Senior Life Solutions, they had changes to a couple policies, some CPT codes that had changed, and their scope of service, basically talking about attendance with the program, and then telepsychiatry. Every once in a while, if it's bad weather or something, they'll use they'll have their therapist be on so that patients can still get their services even though they don't want to drive to the program that day. And that's pretty much all of the policies and policy changes for full manuals. So then we also look at any policy changes from the previous quarter. So this is the end of the year, October, November, December of last year. So changes that had occurred just in that time frame. Behavioral health looked at some of their attendance requirements for their program and formulated a policy related to that. And then basically had a lot of definition changes. So a lot of their policies were just mainly definitions changes and a few things there. Diagnostic imaging for MRI and CT contrast now, and I think we talked about this with medical staff, but basically there's some new requirements for blood work that has to be done prior to those exams. So creatinine and GFR changes that were made, new standards that are out there that they implemented. Human resources, some changes to their PTO policy for patients who have callback, and whether or not in a week's time if they want to use PTO or callback. Kind of as one of those things that goes over a weekend, so it can change some things. We changed that policy a little bit. Occupational health changes for their off-site services with bell tone for audiograms, and added on-site testing in OHO with the same services. Perioperative department, we've been working very closely on a smoke-free facility. As you know, we don't allow actual cigarette smoking in our facility, but this is totally different. In surgery, as you know, you often use cautery. Cautery can produce a smoke. So basically making this safe for both patients and staff, and making sure that smoke is contained and does not go out into the environment to be inhaled.
And how do you contain the smoke?
It's like vacuums. They have actual vacuums that as they're going, it'll pull the smoke off. So just making sure that that's a standard for every surgery that uses cautery now. Let's see, and then some new guidelines that, in surgery they use a lot of, we call them pans. So basically all of your surgical instruments, they can be heavy metal instruments, and no pan, basically all of those instruments can weigh over 25 pounds, basically to help prevent any injuries with our staff. That is a new policy they had as well. So that pretty much sums up all the policies and procedures. All of the policies and procedures are reviewed at our joint conference committee meeting. Jan and now James are a part of that committee, and we also have medical staff, nursing staff, the department manager, etc. Opportunity for anybody to review those policies and procedures. Once it goes through that, then it goes to the full medical staff for approval, which it has done, and then goes to the board for final approval. So I am asking for approval for all of the policies and procedures as presented.
I'll make a motion to approve the policies and procedures as Karen presented them.
First, do we have a second? James, second. All in favor?
Aye.
Opposed? Motion carries.
Thank you.
We will go to the Personnel Committee report. Jim isn't here.
And Janine's probably going to have
Hold on, everybody, sing or something. I can't see. Thank you. The Personnel Committee met right before the board meeting. We had one initial appointment, 3 reappointments, and 1 voluntary withdrawal. I'd make a motion to approve these.
I'll second that.
Thank you.
We have a first and a second. All in favor?
Aye.
Opposed? Motion carried. The CEO report.
So I wanted to first talk about our general surgeon, and Dr. Hodges leaving. We're going to be aggressively pursuing recruitment of another general surgeon. We're looking at a lot of different options here and how we move forward with that. He gave 90 days notice, so he'll be done in the middle of May. Don't anticipate that we'll have a permanent solution by that date. So we are looking at some locum tenens, temporary type coverage to take over in May. So we're looking at a couple different recruitment firms that we've used in the past. Jackson Coker does more of the locum tenens, possibly a locum to permanent. Sometimes they transition from temporary to permanent. That's what they kind of specialize in. Jackson Physician Search, which I think is a kind of a sister company, they do more of the permanent searches. So we're talking with both of those entities, have had some success with both of those entities. So working with those two search firms. We've also had some discussions with Methodist Health System in the past. They've kind of provided us some temporary general surgery support. So just really started talking to them here in the last week. They're going to kind of see what kind of capacity they have right now, and we'll continue to have those discussions with Methodist as well. Possibly there is a solution there that could be more permanent with them, but we're just really starting to have those discussions now. We also work with Wapiti, which is our emergency room third-party consultant. They provide us with ER physicians. They also have a line of service where they do physician recruitment. So they're kind of working for us as well. So that's kind of where we are with physician recruitment, general surgeon physician recruitment. We'll be fairly aggressive in moving forward with getting that position replaced. Any questions on that? Did want to just talk about this Top 100 award. Some of the board members maybe aren't familiar with that. So they've been doing this Top 100, the Chartist Group has been doing this Top 100 award for the last 14 years. We've been on that Top 100 list 11 of those years. This year, they give you an index rate, which basically says what percentile you're at. This year, we're at the 99th percentile, which means we rated, based on their metrics, rated higher than 99% of the 1,300 critical access hospitals in the nation. And the things that they look at, I mean, they have a lot of different metrics, but they kind of all roll up into 8 different areas. 2 of them relate to market share. There's one for inpatient, one for outpatient. They do look at their value metrics. They have 5 different value areas. Quality is one of them. Outcomes, patient perspective. Patient perspective is based on these inpatient satisfaction surveys that we do. And then cost and charge. And then the last one is based on finance, and they're really just looking at our net income, bottom line net income in comparison to our gross revenue on that. So 99th percentile, like I said, 11 years out of 14, there's only 9 hospitals in the nation that have had gotten this award either 11 or more times. So I think, and it is all publicly reported data. This isn't something we apply for. A lot of it is Medicare information based on Medicare claims and our Medicare cost report that we file each year. So I think it's really important. What's important, I think, is the consistency. 11 out of 14. I think there's a lot of hospitals that maybe can get on this list one year or 2 years over the last 14 years, but we've been on it 11 years. So, and the 2 years, I think the first year this came out back in, would have been probably 2010, something like that. The first year we didn't get on the list. And then there's been 2 other years. And in those 2 years, one year we were at the 91st percentile, which wasn't quite good enough to get in the top 100. The other one was, we were at the 89th percentile. So even though we didn't make it, we were still, ranked quite high. So I just wanted to give you some information on that. We will be celebrating this award along with our 70th anniversary and probably along with our Hospital Week celebration in May, just to show appreciation for our staff and all that they do. And then the next item I just wanted to briefly mention, and Dr. Anderson already talked about this, the weekend clinic. Just to give you some numbers on that, we started this January 20th, was our first week. That Saturday clinic, we had 14 visits, and the Sunday visit, we had 1 visit. But since then, over the last, I guess, 6 weekends, so last week we were at 25 patients on Saturday, which is a very busy day for one provider. Or did we actually have 2 providers that day? Are we still with 2 on?
No, was it last weekend you said?
Last weekend.
No, that was Claire only.
Yeah, so 25 that's a really busy Saturday. And then on Sundays, we've been as high as 13. I think these last couple Sundays have been 10. So it's definitely serving the purpose that we're looking for, to have a place for patients to avoid going to the emergency room if they needed that type of care. So I think, like Dr. Anderson said, I think both providers are doing very well, and pleased with the way that's going so far.
Barry,
Any other?
is there any way to know how many of those patients initially went to the ER and then were referred to the clinic, or are they finding the clinic on their own?
Typically, they find the clinic on their own.
That's good.
Because if they present to the ER, we have to see them in the ER.
Oh, you do?
They can't.
Oh, regularly. We'll see it.
Yeah.
Okay. Okay.
Yeah. But typically they find us.
That's awesome.
We've had kind of a split between those patients that are calling in and scheduling an appointment, and those that are just walking in.
Thank you.
Okay, I think that's all I have for my report. I think maybe Jeff was just going to make a few comments on the emergency room project.
Yeah, so emergency room, the pictures I've been able to send out the last few weeks or month really haven't changed a whole lot, because most of the work is being done above, focused above the ceiling, running pipes, cable tray, insulating the pipes and the vent work and everything. The sheetrock has been progressing along very well. The east half of the construction area is essentially ready to be painted. They're prepping for that over the next couple of weeks to start painting. So a lot of cosmetic changes will be coming up. So things are moving very well. We should, with this nice warm weather, they're talking with the concrete vendor to start up again. We got a little bit outside, and this week have some cutouts that they should be filling in today or tomorrow to level the floor, and then they can start focusing on further leveling. So things are going on the ED and the cafe pretty well. One other thing that Jim had mentioned last board meeting was the water softener. That was turned up last week, so the entire hospital now is on soft water, where before our central utility plant it was only hot water. So good step there.
Thanks, Jeff. Good job at Myrtue on the top 100. That sets the bar pretty high going forward, so keep at it. The team does a fantastic job. Next we'll go to the approval of the monthly financials by Christie.
Okay, first thing I wanted to talk about is as we're transitioning from our self-insured plan to our current insurance plan, we have to do all of these claims that are back claims that are still on our insurance plan. So as those are coming in, we get billed for those, and we have to pay those out, and we try and do an estimate. The bills have come in a little bit higher, so feeling that we needed to adjust December a little bit because those claims are higher, I did go back in our records and make a $225,000 adjustment to December's financial reports, which has already been approved from the board. So originally we had a net income from all sources in December, if I can get my fingers to work, of 401,000, and that brought it to 176, which is still a good number, but those were for December claims, so to report, and it was material enough that I felt we needed to report it in the appropriate period. So I did go back, so if you looked at December and looked at the January one, there might be a difference. I'll get this to Ruth and she can send it out to you, also the revised December financial reports. So that should, every month that we get billed, it should decline as those payout claims go down, but we do have a policy, basically an insurance policy that says they can't go over X amount of dollars, or Blue Cross and Blue Shield just picks them up on their own. So we do know what our max is. So just to go through January then, had a fairly good busy month again in January. We did have outpatient visits of 4,331, ER visits of 467, 120 surgical procedures, 3,419 physician clinic visits, and behavioral health visits of 1,481. Average daily census was at 9.52. We had 3 births in January, a little low there. 4.85 million in revenues and 4.75 million in expenses. And other non-operating of 200,000, so we're at a $312,579 income from all operations, all sources for January 2024. That compares to 275,317 last year for the same time period. So operational wise, we're doing well. Year to date, as you can see, our outpatient visits are up 1.4%. Emergency room visits are up 0.2%. Surgical procedures are up 3.6%. Our physician clinic visits are down 1.4%. In January, we had a couple snow days there too, which would account for a little bit of that decline. Same with behavioral health, 8.7% decline there. Our average daily census continues to go down historically at 12.8%. On average year to date, we've had 8.3 patients in the hospital per day. That includes OB. It doesn't include nursery like a baby, but it does include the OB inpatient. We've had 44 births compared to 55 last year, so we're down about 20%. Our revenues are up 5.4%. Our expenses are up 4.6%. Our other net operating is down 7.5%. A lot of that is kind of the COVID money that was finalized in 2023. But overall, we're up 13, our net income is up 13%. And I do have the year-to-date one there for the first 7 months of the last 4 years. As you can see there, our outpatient visits have just continued to climb from 29,428 to 33,411 this year. Emergency room visits, kind of see some ebbs and flows there, but the last 3 years have been consistently over 3,400, almost 3,500. Surgical procedures, we are rebounded since we've kind of had some change in staff and COVID in there. That was one department that was hit, so we're at 837. Compared to in 2021, we were at 838. So physician clinic visits, 23,819 in 2021, and we're at 24,610, so still seeing growth. Behavioral health, we still have seen some growth there, 8,271 in 21 to 8,657 here in 2024, and we'll continue to see that rise. We've had a couple new providers down there, so we are seeing that go up. Average daily census, you can see there, we continue to go down 9.25 in 2021 to 8.31. Births were, last 3 years have been pretty consistent. They in the 45 to 55 range. And you can see, in 2021 and 2022, we had extra COVID money, so our income was higher at around 2.3, 2.7 million. Now, these last couple of years, when that's run out, we've been at 1.3, basically the last 2 years, so. Any questions on the financial reports?
I'll move the approval of the January financial report.
Second.
We have a first and a second, all in favor?
Aye.
Opposed? Motion carries. Approval of payroll and claims. Are there any questions on those? Can I get an approval?
The approval of the January payroll and claims.
We have a first.
Second.
Janine, second. All in favor?
Aye.
Opposed? Motion carries. Anything else to discuss, Barry?
Well, I do have one thing I want to do today. Want to thank Janine for her years of service as our chairperson. So we have a plaque, and I'll just read this to you. This achievement is presented to Janine Larson in appreciation of your outstanding leadership, commitment, and service to the Myrtue Medical Center Board of Trustees. Chair of Board of Trustees, January 22 through December of 23. So thank you, Janine.
Thanks, buddy. I enjoyed it.
One other thing, no March meeting.
That was going to ask that. Yeah.
No March board meeting.
Really? We know that already.
As of today,
Okay.
no March.
We work efficiently. We got two for one here.
Now we have you.
Awesome, awesome. Well, great. I don't have anything else, so we get a motion to adjourn.
I'll move to adjourn.
Second.
First and a second, all in favor?
Aye.
Opposed? Carried.
Have a good day, Kate.